Hi all, this presentation will address some facts on falls and injuries, an imperative topic among older people. We will then discuss falls, the harmful effects it has on physical and mental health, and then go on to discuss some ways to overcome the fear of falling and what to do if you or someone around you falls. Every year, millions of people fall and suffer both fatal and non-fatal injuries. Among adults aged 60 and older, falls are the leading cause of injury. Such injuries can make it hard to carry out day-to-day activities, get around independently, and increases the risk of early death. The most common of the fractures are of the ankle, leg, pelvis, hip, spine, upper arm, forearm, and hand. Just for some fast facts. So approximately 1 in 3 older people will fall, and around 25,500 people will die every year. Men are twice as likely to fall and die from a fall in comparison to women, and around 20 to 30% of people who fall will experience moderate to severe injuries. Falls are most commonly the consequence of and result in a traumatic brain injury. So how do I prevent falling? So we must ensure paths are well lit and that walkways remain clear. We must clean spills or messes as soon as possible and try to avoid wet bricks, tiles or other slippery surfaces. We must ensure shoes fit comfortably, are non-slip and have low heels, and ensure we exercise. Exercise is important as it strengthens bones, muscles and joints and improves balance, flexibility and strength. What do I do if I fall? So remain still and try to keep calm. Consider, are you hurt? If you move too suddenly, you may make your injury worse. Do you feel comfortable in standing up yourself, or do you need help? So if you feel yourself, firstly, roll onto your side and rest. Second, slowly roll onto your hands and knees and crawl to something to assist you to stand. And finally, put your hands on the object and slowly rise until you're up. Then take another rest. Stand by yourself or are injured, ask someone for help, call 000 or ask someone else to call 000. Fear of falling. What is this fear of falling? Many people who fall develop a fear of falling. Often those who fall but are injured are the most likely to develop this fear. This can sometimes be immobilizing and can prevent people from engaging in day-to-day activities. Some people may choose to stay home instead of carry out their normal activities and withdraw from others, becoming very socially isolated. This can also be detrimental to one's mental as well as physical health. When you stop exercising, going shopping or visiting loved ones and instead stay at home, your muscles and bones can become weaker. Consequently, you can become more likely to fall. Include those typically exhibited by anxiety, including sweating, irritability, nervousness, unusual quietness, an increase in blood pressure, or even if they lack the desire to leave the house, among others. This fear. There's no clear-cut way to overcome a fear, and everyone is different. After reviewing some psychological papers and referring to online forums, here's some things that may help you or someone you may know. Be that little engine that could. If you're positive and have a proactive mindset, achieving your goal and overcoming fears should be easy for you. Remain calm. Face your fears your way. Warm up slowly, there's no need to rush. Turn a negative into a positive. Some people have benefited from rewarding themselves when a goal is achieved. So if you walk to the mailbox and back, watch an episode of your favourite show or have a sweet. Try to break the cycle. Again, slowly warm up. Go further and further each time. For example, on day 1, walk to the mailbox. On day 2, walk to the car. And in a fortnight, go to the grocery store. Remember, the little steps are the ones that have the most impact. Focus on the end goal. Remember that little engine that could. He needed to put all of the carriages over the hill, and slowly but surely, with that positive I think I can attitude, he succeeded. Alternatively, some people have recommended seeking professional help from psychologists, hypnotists, and so on. What do I do if I want to help? So if you've noticed that a friend has become distant, here's a few things you can try. First, you could try to learn why they're afraid and talk with them about ways to overcome this fear. Secondly, be supportive. Keep them balanced, both emotionally and physically. So ensure that the environment is safe and reinforce it sensitively. You could recommend classes or outings or even visit the doctor with them. In essence, you're helping them help themselves. So in conclusion, if you or a loved one has fallen, have a fear of falling, or have any other questions, make sure you tell your doctor or specialist. Eliminating this fear can help you maintain your physical abilities, improve your mental health, and help you prevent future falls. Please review these references I've included in this slide. Thanks for watching.